Clinical Scenario 1, a 30-year-old female presents with recurrent episodes of palpitations, anxiety, and lightheadedness. Her ECG during an episode reveals a narrow QRS complex tachycardia with no visible P waves. What is the most likely diagnosis? A. Atrial fibrillation. B. Ventricular tachycardia. C. Supraventricular tachycardia, SVT. D. Atrial flutter. Answer: C. Supraventricular tachycardia, SVT. Explanation: SVT often presents with narrow QRS complex tachycardia and no visible P waves on ECG. It typically originates above the ventricles, and episodes can be terminated with maneuvers like Valsalva or adenosine. Clinical Scenario 2, a 45-year-old woman presents with a 1-year history of heavy menstrual bleeding. She has completed childbearing and desires definitive treatment. Pelvic ultrasound reveals multiple uterine fibroids, and endometrial biopsy is normal. What is the most appropriate management for this patient? A. Oral contraceptives. B. Levonorgestrel releasing intrauterine device, IUD. C. Uterine artery embolization. D. Hysterectomy. Answer: hysterectomy. Explanation: for a patient with completed childbearing who presents with heavy menstrual bleeding and uterine fibroids and desires definitive treatment, hysterectomy is often the most appropriate management option. This procedure provides a permanent solution for fibroid-related symptoms. Oral contraceptives, choice A, and levonorgestrel releasing IUDs, choice B, are typically used for medical management but do not provide a definitive cure. Uterine artery embolization, choice C, is an alternative to surgery but is not considered a definitive treatment in all cases. Clinical Scenario 3, a 55-year-old male presents with right upper quadrant abdominal pain, nausea, and vomiting. On physical examination, he has tenderness in the right upper quadrant, and Murphy's sign is positive. Laboratory tests show elevated liver enzymes and a total bilirubin of 2.5 mg/dl. What is the most likely diagnosis? A. Acute cholecystitis. B. Acute pancreatitis. C. Acute appendicitis. D. Peptic ulcer disease. Answer: A. Acute cholecystitis. Explanation: this patient's presentation with right upper quadrant pain, nausea, vomiting, and a positive Murphy's sign is indicative of acute cholecystitis, typically associated with gallstones obstructing the cystic duct. Elevated liver enzymes and bilirubin can occur due to inflammation and edema involving the gallbladder wall. Acute pancreatitis, choice B, would present with epigastric pain radiating to the back and elevated pancreatic enzymes. Acute appendicitis, choice C, involves the right lower quadrant, and peptic ulcer disease, choice D, would not cause a positive Murphy's sign. Clinical Scenario 4, a 40-year-old female presents with a breast lump that is mobile and tender. Mammography reveals a well-defined, round mass. Fine needle aspiration FNA, cytology shows foamy macrophages and multinucleated giant cells. What is the most likely diagnosis? A. Fibroadenoma. B. Breast abscess. C. Ductile carcinoma in situ, DCIS. D. Lipoma. Answer: breast abscess. Explanation: this patient's presentation with a tender, mobile breast lump, along with FNA findings of foamy macrophages and multinucleated giant cells, is consistent with a breast abscess. Breast abscesses often occur in the setting of lactational mastitis. Fibroadenoma, choice A, is usually painless and not associated with infection. C, choice C, is unlikely to present as a tender, mobile lump, and a lipoma, choice D, would not typically cause breast tenderness. Clinical Scenario 5, a 22-year-old female presents with lower abdominal pain and a positive urine pregnancy test. On transvaginal ultrasound, there is an ectopic pregnancy in the right fallopian tube with free fluid in the pelvis. What is the most appropriate initial treatment? A. Intravenous ceftriaxone and doxycycline. B. Methotrexate injection. C. Laparoscopic salpingectomy. D. Oral contraceptives. E. Emergency caesarean section. Answer: B. Methotrexate injection. Explanation: The diagnosis of an ectopic pregnancy with free fluid in the pelvis can be managed initially with a methotrexate injection, choice B, to terminate the ectopic pregnancy. Surgical options like laparoscopic salpingectomy, choice C, may be necessary in certain cases, but methotrexate is often attempted first. Choices A, D, and E are not the primary treatments for ectopic pregnancy. Clinical Scenario 6, a 40-year-old male with a history of chronic alcohol abuse presents with hematuria and flank pain. A non-contrast CT scan of the abdomen reveals a large, hyperdense mass in the right kidney with areas of necrosis. What is the most appropriate initial treatment? A. Intravenous antibiotics. B. Renal biopsy. C. Immediate nephrectomy. D. Observation and follow-up imaging. E. Palliative care referral. Answer. C. Immediate nephrectomy. Explanation: the presentation of a large, hyperdense mass with areas of necrosis in the right kidney in a patient with a history of chronic alcohol abuse raises suspicion for renal cell carcinoma. The most appropriate initial treatment is immediate nephrectomy, choice C, for both diagnostic and therapeutic purposes. Choices A. Intravenous antibiotics, B. Renal biopsy, D. Observation, and E. Palliative care referral, are not the primary interventions for suspected renal cell carcinoma. Clinical Scenario 7, a term newborn presents with severe respiratory distress shortly after birth. Physical examination reveals subcostal retractions, nasal flaring, and grunting. Oxygen saturation is 85% on room air. What is the most likely diagnosis? A. Transient tachypnea of the newborn, TTN. B. Meconium aspiration syndrome, MAS. C. Respiratory distress syndrome, RDS. D. Pneumonia. E. Congenital diaphragmatic hernia, CDH. Answer. E. Congenital diaphragmatic hernia, CDH. Explanation: CDH is a congenital defect in the diaphragm that allows abdominal organs to herniate into the chest cavity, leading to severe respiratory distress. It often presents with subcostal retractions, nasal flaring, grunting, and decreased oxygen saturation. TTN, MAS, RDS, and pneumonia may present with respiratory distress but have different clinical characteristics. Clinical Scenario 8, a 6-year-old child presents with an abdominal mass, weight loss, and pain. Imaging shows a large abdominal tumor. Biopsy reveals small round blue cell tumors. What is the most likely diagnosis? A. Neuroblastoma. B. Wilms tumor. C. Rhabdomyosarcoma. D. Ewing sarcoma. E. Hepatoblastoma. Answer. C. Rhabdomyosarcoma. Explanation: rhabdomyosarcoma is a malignant tumor of striated muscle origin commonly presenting as an abdominal mass in children. The small round blue cell appearance on biopsy is characteristic. Neuroblastoma, Wilms tumor, Ewing sarcoma, and hepatoblastoma have different histopathological features. Question 9. Which surgical procedure is commonly performed for symptomatic gallstones? A. ERCP. B. Cholecystectomy. C. Colonoscopy. D. Pancreatic duodenectomy. Whipple procedure. Answer. B. Cholecystectomy. Explanation: cholecystectomy is the surgical removal of the gallbladder, commonly performed for symptomatic gallstones. Question 10. Which of the following is a surgical treatment option for generalized obesity? A. Gastrostomy. B. Diet and exercise. C. Gastric bypass surgery. D. Lipectomy. Answer. C. Gastric bypass surgery. Explanation: gastric bypass surgery is a surgical treatment option for obesity, which helps in weight loss by reducing the size of the stomach and altering the digestive process.